Hi everyone, this is a detailed video about atypical depression. Well, any type of depression can make you feel sad and keep you from enjoying life. However, atypical depression, also called depression with atypical features, means that your depressed mood can brighten in response to positive events. Other key symptoms include increased appetite, sleeping too much, feeling that your arms or legs are heavy, and feeling rejected. Despite its name, atypical depression is not uncommon or unusual. It can affect how you feel, think, and behave, and it can lead to emotional and physical problems. You may have trouble doing normal day to day activities, and sometimes you may feel as if life is not worth living. Earlier on this channel, I have already uploaded video about atypical depression. That was a short video, and today I am going to discuss this illness in detail. Well, first of all, let me tell you the symptoms. Well, symptoms of atypical depression can vary from person to person. Key signs and symptoms may include depression that temporarily lifts in response to good news or positive events, increased appetite or weight gain, sleeping too much but still feeling sleepy in the daytime, heavy, leaden feeling in your arms or legs that lasts an hour or more in a day, sensitivity to rejection or criticism, which affects your relationship, social life, or job. For some people, signs and symptoms of atypical depression can be severe, such as feeling suicidal or not being able to do basic day-to-day activities. If you feel depressed, make an appointment to see your doctor as soon as you can. Atypical depression may get worse if it is not treated. If you are reluctant to seek treatment, talk to a friend or a loved one, a healthcare professional, a faith leader, or someone else you trust. If you think you may hurt yourself or attempt suicide, you should call your local emergency number as soon as possible. If a loved one or friend is in danger of attempting suicide, then you should try to call the local emergency numbers. Okay, now I will discuss the causes of atypical depression. It is not known exactly what causes atypical depression or why some people have different features of depression. Atypical depression often starts in the teenage years, earlier than other types of depression, and can have a more long-term chronic course. As with other types of depression, a combination of factors may be involved. These include brain differences. Neurotransmitters are naturally occurring brain chemicals that carry signals to other parts of your brain and body. When these chemicals are abnormal or impaired, the function of nerve receptors and nerve system change, leading to depression. Inherited traits. Depression is more common in people whose blood relatives also have the condition. Now I'll tell you some risk factors. Well, these include history of bipolar disorder, misuse of alcohol or recreational drugs, traumatic childhood experiences, environmental stressors. Your risk of atypical depression may also increase if you have blood relatives with a history of depression, bipolar disorder, or alcoholism, stressful life events such as the death of a loved one. Now I'll tell you some complications. Like other types of depression, atypical depression is a serious illness that can cause major problems. Atypical depression can result in emotional, behavioral, and health problems that affect every area of your life. For example, atypical depression can be associated with weight gain due to increased appetite, personal and work relationship problems due to rejection sensitivity, drug or alcohol use due to trouble coping, other mental health disorders such as anxiety, suicide from feelings of depression. Well, regarding major depression, there is a video on this channel that is very helpful video. You can watch that video. Okay. Now I'll tell you some preventive measures. Well, there is no sure way to prevent atypical depression, but the strategies which I'm going to tell you now may help. First of all, take steps to control stress, to increase your resilience, and to boost your self-esteem. And then you should reach out to family and friends, especially in times of crisis, to help you weather rough spells. Get treatment at the earliest signs of a problem. To help prevent depression from worsening, consider long-term maintenance treatment to help prevent a relapse of symptoms. Okay, now I will tell you the diagnosis. Well, when the patient comes to us, we do exams and tests. that can help us to rule out other problems that could be causing your symptoms. First of all, we'll do physical exam. We may do a physical exam and ask in-depth questions about your health to help determine what may be causing your depression. In some cases, depression may be linked to an underlying physical health problem. Lab test, for example, your doctor may do a blood test called a complete blood count or test your thyroid to make sure it is functioning properly, because there are some thyroid problems that can lead to depression. Okay. Then we also do psychological evaluation to check for signs of atypical depression. We will talk to you about your symptom, thoughts, feeling, and behavior patterns. Then we may ask you to fill out a questionnaire form to help answer these questions. Then to help make a diagnosis, we may compare your symptom with the criteria in the Diagnostic and Statistical Manual of Mental Disorders, that is DSM-5, published by American Psychiatric Associations. Now I will tell you the treatment of atypical depression. Well, medication and talk therapy, that is psychotherapy, are effective for most people with depression, including atypical depression. Your primary care doctor or psychiatrist can prescribe medication to relieve symptoms. However, many people with atypical depression benefit from also seeing a psychologist or other mental health professional. If you have severe depression, you may need a hospital stay, or you may need to participate in an outpatient department program until your symptoms improve. Now I'll give you a closer look at treatment options. First of all, I'll let you know about certain medications. And the first, I will talk about monoamine oxidase inhibitors. Well, these are the oldest class of antidepressant medication, but they can have serious side effects. However, some experts feel that MAOIs, monoamine oxidase inhibitors, especially phenelzine that comes with the name of Nardil, can be effective for atypical depression. They may also help with anxiety, panic, and other specific symptoms. Using these drugs require a strict diet because of dangerous or even deadly interactions with certain foods and some prescriptions and over-the-counter medications such as decongestants and certain herbal supplements. MAOIs cannot be combined with selected serotonin reuptake inhibitors. Okay. Now I'll tell you some other antidepressants which normally I prefer. These are the selective serotonin reuptake inhibitors, most notably sertraline that comes with the name of Zoloft, and fluoxetine that comes with the name of Prozac. And these can be effective alternative to MAOI inhibitors. And also I should tell you that tricyclic antidepressants are not as effective, but may be an option for treating atypical depression. Other antidepressants may be beneficial but have not been systematically studied for atypical depression. You should discuss possible benefit, risk, and side effects of medication with your doctor and pharmacist. You may need to try several medication or a combination of medication before you find one that really works. This requires patience, as some medication needs several weeks or longer to take full effect and for side effects to ease as your body adjusts. And now I'll tell you a little bit about psychotherapy. Well, this is also known as talk therapy. It is a general term for treating depression by talking about your condition and related issues with a mental health professional. CBT or cognitive behavioral therapy, as well as other types of psychotherapy, can help you learn how to identify and change unhealthy behavior or thoughts, explore relationships and experiences, find better ways to cope and solve problems, set realistic goals for your life, regain a sense of satisfaction and control in your life, help ease depression symptoms such as hopelessness and anger. As part of your treatment, it is important to also address other conditions that often accompany atypical depression, in particular anxiety and drug or alcohol misuse, as they can make your depression more difficult to treat. Now I will tell you some lifestyle and home remedies. Depression generally is not an illness that you can treat on your own, but in addition to professional treatment, the simple self-care steps which I am going to tell you can help. First of all, you should stick to your treatment plan. Do not skip psychotherapy sessions or appointments even if you are feeling well. Do not skip your medication. If you stop, depression symptoms may come back, and you could also experience withdrawal-like symptoms. You should learn about depression. Education about your condition can empower you and motivate you to stick to your treatment plan. Encourage your family member to learn about depression to help them understand and be supportive of you. Well, regarding this, my channel is a health education channel, so you can learn a lot from this channel. Okay. Also, you should pay attention to warning signs. Work with your doctor to learn what might trigger your depression symptoms. Make a plan so you can know what to do if your symptoms get worse. Contact your doctor or therapist if you notice any changes in symptoms or how you feel. Ask relatives or friends to help watch for warning signs. You should take care of yourself, eat healthy, and be physically active. Consider walking, jogging, swimming, gardening, or another activity that you really enjoy. Sticking to a regular routine can help improve your mood. Avoid alcohol and recreational drugs. It may seem like alcohol or drugs lessen depression symptoms, but in the long run, they generally worsen symptoms and make depression harder to treat. You should talk with your doctor or therapist if you need help with this issue. Regarding alternative medicine, there is hardly any role, so I will advise you to stick to your doctor advice. Okay, so this was my video about atypical depression. I hope you like this video. If you have any questions about this, please do not forget to post your question in the comment section. Thanks for watching this video. See you in the next video. Bye for now.